This was not Haruv's fault. They had me, we had everything ready, but something went wrong. So I was having a nervous breakdown, so I don't know what Gal said about me, so I'll start over. And so my name is Dori Rivkin. I'm a team leader at MJB, which is Myers-JDC-Brookdale in Jerusalem, which I'll tell you about in a moment. And my English is relatively accent-free because I was born in the United States. My parents came to live in Israel when I was 8. One of the things that, so I actually, I've been working at Myers-Brookdale for a very long time, for about 25 years. So I've had quite a lot of experience in all kinds of areas. We are Israel's largest applied research institute. And what that means is that we do research on lots of different social issues, and they're all aimed at helping the services provide better service for people who need them, in a nutshell. So we're interested, of course, in learning about why things happen and how things happen and theories, but really everything that we do is outcome oriented so that we will help the services do a better job. So we work in lots of different fields. I started out in children at risk, and I worked a lot in the area of child abuse and working with families. And then I moved over to disabilities of all ages and all types and all aspects of their lives. And now I'm actually working in another area at Brookdale, which has to do with poverty and marginal populations, like people who are in trouble with the criminal system, prostitution, homeless, etc. So what I find really exciting about where I work is that everything is connected. So this, for example, is a project that I really found interesting because children and disabilities, let's see how it goes together or doesn't, or how it's different, and how what we learn from one area can teach us about other areas. So I was, unlike what Gal said, I was quite happy to be invited to give this lecture and to be able to go to an international conference from my living room. And so what I'm going to talk about is, as you say, are children with disabilities more likely to experience abuse and neglect, and why? And I'll start out with a few incidents. So I think I'll just read them, because one of the things that I learned in working in disability is that not everyone can easily read from the screen. So a 14-year-old boy, apparently disabled, who had not left his home since the age of 2, was found today by police officers inside a shed sealed with iron and rubbish heaps, suffering from criminal neglect by his parents. The boy was evacuated by MADA, that's our emergency service, to the hospital while his parents were detained for questioning. Hannah, a 13-year-old girl with intellectual disability, started showing behavior problems such as negativity and temper outbursts. The school assigned a volunteer to try to help. Once she won Hannah's trust, Hannah told her that she got special attention from her father, that they slept together in the same bed, and that he touched her at night. It doesn't always feel good, but this is how good girls behave. The volunteer was shocked and told the school counselor. The father was taken for questioning and eventually confessed having sexual intercourse with his daughter. And another incident also connected to sexual abuse. A 13-year-old boy with intellectual disability was sexually harmed in a synagogue near his home. One Friday evening, which is when Jews typically gather in the synagogue for prayer, one of the worshipers invited him to enter the synagogue with him and sexually assaulted him there. A few weeks later, the offender passed him and his mother on the street. He began to tremble and behaved according to his mother strangely. His mother insisted on understanding what was happening to him, and then he told her about the abuse. So these are all cases, stories, anecdotes that could have been in the paper, or they could have been discussed at a social work conference or at a staff meeting. And they're very typical in some ways. I mean, sexual and other kinds of abuse are very often hidden, but here the disability and the abuse very much interfaced. So people in Israel, from the various services that deal with child abuse, began to become aware that there was an issue that needed to be addressed around child abuse of children with disability. That's the acronym that I used throughout this presentation. So an intergovernmental team was set up to try to deal with this issue and try to find out what needed to be done, how to do better prevention, how to do better screening, how to intervene. And a lot was around the issue of, should the regular services be adapted for children with disability, or do they need new and different services? And this initiative was led actually by Haruv in Israel and by Ashalim, which I don't know if any of you have heard of, but it's a very large and significant organization that works with the government on improving services for children. And it's based basically on a government between American Jewish philanthropy and the Israeli government. So, so all these different government offices got together, the police and the Ministry of Justice and the Ministry of Education and the welfare and the Social Security and organizations of parents of children with disability and child protection organizations. And they sat down to try to come up with good recommendations for the police and for the policy, and to come up with a program. And basically they said, well, we know that children with disability are more likely to be suffer abuse or neglect because we read that that's the case elsewhere, but we don't know if that's the case in Israel. We have no idea. So they came to us because we're the research institute, we're the people who do the numbers. And they said, you know, we want to know, tell us, give us some data so that we can go to the Treasury and show the need and ask for money for doing all these things. So we said, well, first we need to learn and understand the phenomenon, and then we'll try to estimate the number. And that was exactly what this team wanted. So we delved into the literature, and I'll show you a little bit of it. So first of all, we began to find all kinds of studies from all over the world that showed that children with disability were far more likely to suffer maltreatment. For example, this is a study from Nebraska that shows that children with disabilities are 3.4 times more likely to suffer maltreatment. And a general survey using data from the United States Health and Human Services showed that it was 11% of children with disabilities suffered abuse versus 4% among other children, which is 2.75 times more. So you might wonder, why are the numbers so different? Like here you see 31 versus 9, and here you see 11% versus 4. And that's because different studies use very different definitions, both of child abuse and of disability. Child abuse in some cases includes neglect, and in some it doesn't. In some cases it includes suspected abuse, in some cases it doesn't. In some cases it includes what we might call more normative types of neglect or abuse, like things like children not getting sufficient supervision. So it might not be, it's always as many of you, I'm sure know, I imagine many of you work in the child protection office area. It's always a question of, the judgment of the professional, but there are very different levels of what you consider risk. And at the same time, there are also very different definitions of who's a child, what makes a child with disability. How do you define it? Is it children who are given special benefits by the government and meet the criteria? I assume that you have something like that in the United States, like we do. Or is it children who are in the special education system? Or is it children with certain diagnosis? Or is it children whose parents say that they have a disability? But what's very, very interesting is that no matter what definition you use, the proportion, the ratio of children with disability versus children without disability in abuse, now, however you define it, is very similar. So I find that very interesting. And overall, the numbers that come up throughout the different studies are 2.4 to 4 times children with disability are more likely to suffer abuse. And that's a very, very robust finding. A little bit more about what kind of abuse children are likely to experiment. So Jones and his or her staff conducted a meta-analysis. Should I explain what a meta-analysis is? It's a really interesting methodology where you can take many, many different studies and turn them into one study, basically, by pooling all of the subjects in the different studies and creating one database out of all of them. So, of course, you have to make sure that the studies are somewhat similar in their definition of what they measured and how they measured it. But it allows, because, you read one study says this and one study says that, and how do you know, what's real, what's the truth? But meta-analysis allows you to take a lot of different studies and look at them as if they were one big study. So this is an example. And they found that among 18,000 subjects with a disability, 20% had experienced physical abuse in childhood, 20% emotional abuse, 14% sexual abuse, and 27% more than one type of abuse. And if you pool all of the different types of abuse, and several of them had more than one type of abuse, you come to a very large number of children who suffered some sort of abuse. Another thing that we found from reading the literature is that the kinds of, that not all the children with disabilities were equally likely to suffer abuse. There were different types of disabilities that were more likely to be associated with abuse. So one study found that children with impairments in communication, learning disabilities, behavioral and sensory disabilities, they were more likely to suffer abuse. Another very large Swedish study found children with mental health disabilities to be more likely, and children who had several missed disabilities. And another study found that children with non-severe disabilities were more likely to suffer abuse than those with severe disabilities. So it's kind of confusing if you look at all these different findings and try to see, okay, so what's the take-home message from all of this? So one of the take-home messages is that different studies find different findings, but overall it seems that if you look at the common denominator, it's issues that have to do with behavior and communication are more likely to increase abuse, the child's likelihood to suffer abuse. And that kind of connects to why children are more likely with disability are more likely to suffer abuse, which we'll get to in a minute. So other studies found that there was also difference in the type of abuse that children with disabilities were subject to. For example, more severe sexual abuse, or that the abuse started younger, before school, for example. So it's not only more abuse, it's also different abuse and often more severe abuse, and certain disabilities are even more likely to suffer abuse. So now we come to the question is why? And you know what? Maybe Gal, is it okay? Can I open the microphone and see if people have any ideas or?
Sure, definitely.
Okay. So does anyone have any hypothesis or ideas why is this the case? Why? Maybe someone wants to write it in the chat. So yeah, so someone wrote here, Andy Hamilton wrote, less able to communicate details of abuse. Absolutely, that's definitely one of the issues. That children with disabilities are less likely to tell or to tell it all, or to be able to tell in a way that people will understand and act upon. And so then they're perceived as being easier prey, you could say, or even my personal bias is that most child abuse isn't sadistic. It's more often parents or caregivers who just can't handle it. And it's just less likely that the situation will come to the attention of someone who's going to help deal with it. So Kaylee wrote, I think the reason the abuse would start before school because they have less communication skills and they can be conditioned not to communicate these details to school teachers, adults, etc. Absolutely. Also, children with disability are more dependent than other children on their caregivers. And right, someone wrote, like I just said, parents may be under more stress dealing with children with disability, with coping skills, and they resort to abuse, again, out of weakness, not out of any desire to hurt their children. And someone else said they rely on helpers more, so predators may gravitate toward those professions. Absolutely, that's also an issue that a lot of children, especially children with severe disabilities, are constantly surrounded by helpers. For example, people who take them, you know, they depend on rides, on what do you call it in English? You know, an organized transportation rather than taking public transportation, and et cetera. Parent burnt out, poor coping skills, low resources, children's inability to communicate needs, hunger, dirty diapers, et cetera, could all absolutely. And behavior might be frustrating and cause parents to lose control. So I think that really pretty much sums up the next slide. I've summarized what the research shows. That children with disability are seen as less likely to understand, resist, or report. And that seems to be particularly true when we're talking about sexual abuse, where they're actually seen as easy prey. There's a greater dependence of children with disabilities on parents and other caregivers. Parents experience higher levels of stress and ambivalence in raising children with disabilities. There's also anger at this child. Why do I have to cope with this? As you know, as much as parents would not want to admit it. Frustration that this isn't the child that I'd been hoping for. They can be very loving parents, but at times that'll come up. And a very, very interesting hypothesis, which I can't say that I found a lot of data to support, but sometimes the disability is actually exacerbated or even caused by abuse. It could also be that children who are abused are more likely to be disabled. And that's pretty easy to see around things like emotional problems, mental problems. I mean, it's almost self-evident that a child who's suffering abuse and neglect is going to develop mental health issues very often. And sometimes even physical things, even, for example, hearing loss can definitely be related to physical violence and all kinds of other physical problems which can cause which can be caused by parental abuse or other people's abuse. And like people said here, the schools and the other service aren't necessarily aware of the high risk and they don't always know how to recognize it. There can even be an assumption that why would somebody want to hurt this child? How could someone sexually abuse this child? They're not considered attractive conventionally maybe. And like people said, they're less likely to report or communicate about abuse. Any questions about this? So I wanted to show you a report which actually Gal, this is a study done by Irit Hershkovitz, who was one of our teachers in our graduate studies. And she's an expert in Israel on child interviews, the police child investigators, which in Israel, at least the police, when a child is investigated for suspected abuse or also as a witness to a crime or anything like that, they're investigated by a social worker, not a police officer. And they use all kinds of special techniques, including techniques for children with disabilities, using communication boards and et cetera. And what she looked at here was how likely children were to expose during the interview, how likely they were to expose or discuss or disclose the abuse. Now, so among children who were being investigated for suspected sexual abuse, 72% of the children without disability told about the abuse. And as you see, when the disability was less severe, then fewer of them. And when it was severe, far fewer children reported abuse. And the same pattern was true about physical abuse. Of course, you can say, but we don't really know if there was abuse. We don't. But the assumption is that, again, a lot of assumptions, that in this study that the likelihood that the child who was being investigated had actually been exposed to abuse was as likely whether they were children with disability or not. So this definitely supports the idea that children with disability might not be reporting the abuse. So, so now we were asked, okay, so give us the data for Israel. We want to know if it's the case in Israel as well. And we said, okay, so give us some numbers. And we were told that there's lots of data. All the people sitting around the table said, we've got tons of data, we have lots of databases, and they gave us 13 different databases which had information regarding child abuse or children with disability. And basically the method that we used was to find databases that had good information, calculate how many of them had, how many of the children within the database were children with disability, and compare them to the general prevalence. I'll get into that a little bit more in a minute. But you might ask, why not do a survey and ask children with disability whether they were subject to abuse and compared to the general population? Wouldn't that give a more reliable answer than trying to extrapolate it from all kinds of existing databases? So the answer is that to do such a survey is very expensive, takes a long, long time. And there's also the issue of disclosure, that they're not very reliable. People are not reliable. The disclosure of abuse by the children obviously wouldn't be, we couldn't ask children, and their parents were unlikely to disclose. So we had to use these. So we said, okay, so let's see what we have. And we looked at all the 13 databases that provided by all kinds of ministries and looked at them. And we actually went and sat down and looked at the numbers and looked at the spreadsheets and said, wait, what's this, what's this, what's this? And we really only found 3 databases that were able to give us information, because the other ones, either they had lots of data about abuse, for example, the hospital reports, but it didn't say anywhere whether the child had a disability or not. And then there were other databases on disability, but it didn't say anywhere whether they were abused. So, but we found 3 good bases. So I want to show you what we found. So first we looked at the child investigator reports, the same investigators that I was talking about a minute ago. And fortunately, the child investigator wrote whether the child had an intellectual developmental disability or autistic spectrum disability. Of course, this was their impression. They didn't have a diagnosis. It could have been off, but that was their impression. And so among those children that were listed as having been interviewed, we found that the children with intellectual developmental disability were 3.5 times more likely to appear in this list than they did in the general population. And with autistic spectrum disability, even more so, 4.8 times more. Then we also looked at another database provided by the Ministry of Welfare, which were the Child Protection Officer reports, which I can tell you was a lot of work to get that data. We actually got it after the study was finished, because we had to go through lots and lots of red tape, but finally they were able to give it to us, of course, unidentified. And we found that among the Child Protection Officer reports, children with disabilities were 2.1 times more prevalent than they were in the general population. So these numbers look very familiar, but still, we didn't know whether they, maybe that was because they were under the spotlight. Maybe they were looking for these children. Maybe they were more likely to come up in these services. So then we found what we thought was really a better source. So this is an opportunity to brag a little bit about a really remarkable national program that we have in Israel, which Haruv was also involved in developing. The National Program for Children and Youth, which is called 360 degrees, because the idea that the name was really too long. And the idea is that the child is surrounded on all sides, but in a good way. So this program, which is about 10 years old, basically the government said we're going to allocate extra funding for services for children and youth, and we're going to give it not to the ministries, but to the municipalities, to the communities. And we're going to let them decide what they want to do with it. Do they want to develop more parenting programs, more well-baby programs, more youth prevention, youth delinquency prevention program, whatever they want, they can do. But they need to come up with a plan which is based on data, which is evidence-based. So therefore, in each community that joined this program, which now covers most of Israel, they did a screening of all the children in the community. Every child in the community from birth to 18 was screened by a professional who knew them well. So if it was a baby, it was the well baby clinics, which are very well attended in Israel, or kindergarten or school. And basically the professionals were asked about each child to about 7 types of suspected abuse or neglect. And they were asked to indicate whether the child, without giving any information on the child's identity, this was just in order to give an overview of what the situation is in that locality so they could plan services. And they also needed to indicate whether the child had a disability or severe disability. So this was great for us because it created a very large database, which was very reliable. We knew exactly how they defined abuse and disability. And it screened everyone. It didn't just it wasn't looking under the flashlight, like we say in Israel. So we found that of all the children who were identified as being subject to abuse or neglect, 25% of them were children with disability, compared to 9% of the children in Israel who are children with disability. And if we looked at all disabilities, the ratio was 2.8 times more. And when we looked at severe disabilities, it was even higher. The ratio was higher. They were more likely to be subject to abuse. And this also allowed us to come up with a national estimate that there were 90,000 children with disabilities in Israel that were subject to abuse or neglect, which is definitely a number that the committee can go back to the government and say, it's a thing, and we need to develop services, and we need funding, and we need training for professionals, and the system has to look and see that it's not a fluke thing that a child with disability happens to be abused. It's actually very common. And that was a really important benefit of the study. So I'm reaching my summary and my take-home message, which is, if you haven't got yet, children with disability are indeed more likely to suffer abuse and neglect. And this is affected by the type of disability, the severity, and having multiple disabilities. Although, like I said, it's not totally clear how it works, exactly what affects. And international findings indicate 2.5 to 4 times higher prevalence, and the data from Israel shows a similar trend. When we were looking at the investigators and at the child protection officers, we came to 2.1 to 4 times, 8 times. And when we looked at the 360 degrees, which we find a much more reliable estimate, it came to about 3 times, which was really kind of amazing to us, because when they came to us, Haruv and Ashalim, and said, we know around the world it's 3 times, and and they asked us, well, how do you know that's the case in Israel? And they said, we don't, let's check. So that was kind of amazing for us. I mean, if you're a researcher, you get excited about numbers like that. So what does this mean for policy? It means that screening needs to take into consideration disability and needs to screen in a way that doesn't leave out children with disability, and the services need to be made accessible or adapted for children and disabilities. And there needs to be a whole therapeutic approach to how disability and abuse interact. Like, what happens when a family loses it? So just as an example, Ashalim, which was one of the organizations that was involved, developed a new service in Israel, which is extremely successful, called a Parent-Child Center for children with disability. No, sorry, I confused that with another service. They developed a family center. And why is that important? That the service is for the family. The children with disability are welcome, they're included, but it's not about them, because often these families spend their whole day running around, finding services, taking the children to their various therapies, taking care of them. The other children in the family are often left out, and they don't often have time for fun and to hang out with other families. They feel very lonely. They feel very exposed sometimes by their children's behavior or disability. And that's, for example, one of the services that this survey definitely gave a boost to, that showed its necessity. So I see there are some questions here. Yeah, so I see that Beth wrote about the shaken baby phenomenon and brain damage caused by starvation. And as horrible as these things sound, they're definitely, I mean, those of you who are in the area of child abuse, I'm sure that you know that the way child abuse became recognized was through radiology, through the unusual bone and skull fractions that radiologists saw, and they couldn't understand how they could have been caused. So these obviously leave a mark, emotional and physical. So does any of this research show higher risk of abuse towards children with mild or moderate intellectual disability? For example, a child who receives, that's a really good question. Like, I really don't know. That's a really good question. Are children who are in regular schools more likely to be abused? Maybe because they're maybe among peers, maybe there's less attention, or are they safer? I don't have an answer to that. Is there research about children, even adults, who are living in group homes or independent? Oh, that's a really painful issue. So we don't have a lot of children in Israel who are living in group homes. There are children in foster care, and that's actually recently the government also via Ashalim is developing a program to specialize foster care for children with disabilities. And one of the things they need to be aware of is that they're more likely to have come from abuse and to suffer abuse within the foster family. They need to be more careful. We know that in Israel, I imagine it's the case in the United States lately, the press in Israel has become a lot more aware of abuse in institutions. I mean, there have been really shocking cases of older abuse of people who were, at night when the directors aren't around anymore, and also people who are in mental health hospitals. I don't know about children, fortunately, but I'm pretty sure that there is, because we do know that in general, children are more likely to experience abuse in institutions, sexual abuse at least, which is really, they've been taken out of home because of abuse or neglect, and often the perpetrator is often their peer within group homes, etc. And that's one of the reasons that Israel is moving away from, as much as possible, from placing children in institutions and group homes. For those with severe disabilities, there are three more likely. Was there a type of abuse? You know what? I don't know. I'm not going to go back to the data, I have to be honest. But I could look and see if we came up with any of the data. I don't think so. Okay, do you think in-home services would help identify and intervene in child abuse? Absolutely. Oh, rather than, probably, yeah. When you come to the home, you see things. You see what's going on. You see the parents. You see even small things about how the home is operating. I think definitely. In Israel, I think less than in America, there's kind of a reluctance to do in-home services. There's kind of, I think maybe thanks to COVID-19, that'll shift. There's kind of this ideology that, you need to go out and go get your services, which isn't always effective, not even financially. So, but that's definitely a good reason to support people coming to the home. Besides that, it gives the parents a lot less hassle getting the kids to the therapy. Is there an equivalent in Israel to our early intervention services? So what are you referring to? What's the Sooner Start in Oklahoma? Laura asked about that. I can't hear. Maybe I put on my earphones. Is anyone speaking? No? So,
Dori, did you ask what is the sooner start in Oklahoma?
Yeah, exactly. Yeah, I couldn't hear anything.
Laura, can you explain, because she's not from here and maybe this information will be helpful? Or someone that know about, doesn't have to be the same person?
Hi, Sooner Start is a program for children under the age of 3 that require things like speech or physical therapy, occupational therapy, things like that, early intervention to try and get them the best start possible.
We don't have exactly the same service. Now that you explained, I know, actually I have a cousin who lives in Boston who, that's what she does. She's a physical therapist, and she tells me about all kinds of homes that she comes into. In Israel, it's more likely to be center-based. So we have these well baby clinics, which are very, very, very widely attended, and they usually refer children who need it to developmental centers for child development, they're called, and the children come and get treatment there, or children with more severe disabilities or conditions go to they have the option of either going to a special daycare where they get the daycare and all kinds of treatments at the daycare from physical therapists, clinical speech therapists, etc. Or they can go to a they can go to a regular daycare, and the professional will come to their daycare and they'll get the treatment there. But we don't have a service that comes home, and now that we're speaking about it, I think that that's actually, it's definitely an added benefit that there's also someone screening and someone who can, even give the mom, some support and tell her where she can get help if she needs it.
Okay, do we have any more questions? I must say that, Dori, I don't know if you know, but we had last year in Oklahoma, Professor Corey Schulman from the Hebrew University. Mm-hmm. She came to Tulsa and she gave a lecture about families who are families with autistic children. And it was very interesting that she was talking about all kinds of different points of view, like how the maternal family is reacting to this child, and how the family from the father's side. Apparently there are differences in the way that they are accepting the child and giving support. How brothers, how siblings are reacting and how it affects them. And it was very, very interesting. It's like understanding all these kinds of situation that the family is dealing with, not only with the child himself and with the society that he needs to go, to special schools and things, but also inside the family, that there are differences of how each side is usually reacting. I'm talking about, research, so it's like in general. So yeah, it was very, very interesting. I hope we'll be able to have her again.
Yeah, I think that autism is actually, I imagine that in the States you also have a huge increase in autism and autistic spectrum disorders that was nothing like a couple of generations ago. And that's worldwide, and they don't exactly know why, by the way. Partly it's because autism is being recognized and diagnosed, whereas in the past maybe it was diagnosed otherwise, but apparently even beyond that there's an increase. And children who are autistic, who don't necessarily look different, and they can it can be very, very, very difficult for the family dealing with the surroundings and people not understanding their behavior and the dynamic, and there can be a lot of shame and hiding, and all of that is extremely stressful and extremely difficult for siblings as well. And there's a whole issue of the younger sibling becomes the older sibling, and I've heard, anecdotal stories of, these wonderful siblings who are so helpful and so, supportive of their parents, and they act so parental because there's a child with a severe disability in the family. And then when nobody's looking, they kind of, get back at them because they're not being seen, and they're also children. And that's something that we're definitely becoming a lot more aware of, that the child is part of a family, and everyone is affected. And sometimes parents really also need just the legitimacy to hang out and enjoy themselves, and sometimes, not do things around the child with disability.
Okay. It seems like we don't have any more questions, and so we will say thank you, Dori. Thank you very much.
Thank you.
Thank you all for joining us.
Hopefully I'll visit Tulsa for real.
After COVID-19.
One day. Yeah.
Thank you all.
Okay.
Great.
Bye.
The rest of the weekend.
Bye. Thank you.
And see you in our next lectures. Have a great day. Bye.